Okay, welcome to my channel. This is Betchama Entrepreneur, also known as Pencil and Eraser channel. Diarrhea is the second leading cause of death in children under 5 years. Over 2.5 billion people lack improved sanitation. So today in this video, we're going to learn about diarrhea. What is diarrhea? Are there types of diarrhea? How can diarrhea be prevented? And what are the causes of diarrhea? And how can diarrhea be managed? Facts about diarrhea. Diarrhea is just a symptom, it's not a disease. It is very important for us to know that diarrhea is not a disease, just like headache, just like fever. It's not a disease. It's an indication that something is wrong. So we must get that right. The underlying cause should be treated. Though, because of the risk involved in that is dehydration in diarrhea, it is better to treat symptomatically at first while digging out the cause of the diarrhea. In fact, it has killed or it continually killed 525 million children every year. 525 million children die as a result of diarrhea diseases. Diarrhea is both preventable and treatable. Over 1.7 billion of children diarrhea disease are reported every year. Diarrhea is also the leading cause of malnutrition and dehydration in children under 5 years. So what is diarrhea? Diarrhea is the frequent passage of watery or loose stool more than 3 times in 24 hours. This is a loose stool or watery stool. The loose stool is that stool that takes the shape of its container. That's a loose stool. So diarrhea is the passage of 3 or more loose stool or watery stool in 24 hours. Diarrhea also may mean having a watery stool or going to toilet more than what is normal for a person. For instance, we have people that go to toilet like once in a day or once in 3 days. So if you start having frequency to like 4 times, it is abnormal for you. So that may pass as diarrhea to that person. We are looking at diarrhea in children. Now, generally, the causes are under these 3 headings, but we are going to break them down. 1. Increased osmotic load. If there is increased osmotic load, there will be diarrhea. That's number 1. 2. Increased secretion or decreased absorption. When there is increased secretion and decreased absorption, your body is not absorbing as it is secreting, there may be diarrhea. Decreased contact time or surface area. When there is the surface area is decreased. Causes of diarrhea in children. Number 1 is antibiotics. Who abuse antibiotics, especially in this part of the world. So that is very important to note. 2. Bacteria. Bacterial infection like E. coli, Campylobacter species, Salmonella species, which is responsible for typhoid, and Shigella species, which is responsible for dysentery, and so on and so forth. Because of lack of, pure water. Pure water, I mean the water that is colorless, tasteless, odorless, and free from impurities. Bacterial infection, there is bound to be fever, there may be bloody stool, there may be abdominal pain. Another one is food allergy. Food allergy may cause diarrhea in some children. Food allergy, they are allergic to a particular type of food. Another one is parasite. Cryptosporidium, Giardia intestinalis, even malaria parasite can cause diarrhea in children. In fact, in children, that may be the first symptom. Viruses, and the number one, culprit is rotavirus. But because of immunization against rotavirus, the diarrhea as a result of rotavirus infection has reduced significantly, and now we have other viruses that are responsible. We have astrovirus, calicivirus, enteric adenovirus, and so on and so forth. So virus still play a significant role in diarrhea disease in children. Then we may have lactose intolerance. They are reacting to dairy products, milk, some animal origin, and so on and so on. It may be as a result of excessive this intake, these children. The temptation out there is so huge. Then some may be as a result of immunodeficiency syndrome, like people with HIV, with immunoglobulin A deficiency, immunoglobulin G deficiency. Are the types. Okay, in children we have acute watery diarrhea. Acute watery diarrhea. 2, we have persistent diarrhea, and we have dysentery. Acute means of sudden, it comes up suddenly. That one may last for several hours and days. And that one may also include cholera. So, like I said earlier, with diarrhea is malnutrition and dehydration. So because they are losing electrolyte, so especially in children, it is important that at their point, you have to replace the fluid immediately. So the second one is persistent diarrhea. That one may last for 14 days. Then the third one is dysentery or acute bloody diarrhea. Dysentery. This one is caused by Shigella species. Shigella spp, like I said earlier. So you see blood in these two. So these are things you don't joke with. Once you see them, you have to take action immediately. So I have some charts on how to know whether the baby, the diarrhea is mild, is moderate, or severe. Okay, like I'll be showing you the chart. Okay, like in mild diarrhea, the skin to go, if you draw it, it goes back immediately. But in a moderate, it may go down slowly. But in severe, you just drag it, continue to struggle. And you see the baby eyes is sunken, the baby may look lethargic, is uninterested in everything around him or her. What are the danger signs? During diarrhea, water and electrolytes are lost. As they are losing electrolytes, it may cause utter sensorium. They are not able to, to curtail themselves. You see them sleepy. See my video on how to prepare oral rehydration solution at home. It's very important. Everybody must know how to do that, whether you're a man or woman. You must know how to prepare ORS. Very, very important. So as they are having diarrhea, you keep replacing the fluid. If you have not subscribed to my channel, what are you waiting for? Subscribe to my channel. I want to thank as many of us have subscribed to this channel. Thank you very much. You are my source of encouragement. Importantly, share the videos. Don't be selfish with them. Share them. Let your friends, your family, let people on your on your group. See the videos. These videos are given out free of charge. This is a young channel, so if there is anything God has laid in your heart to help the channel, we are in need of so many things, to keep the channel running. We don't have a permanent studio yet, and there are so many things. Please, you can reach out to us. My number will be there. Reach out. So thank you very much. So let's continue on our discussion on diarrhea. If the child begin to vomit or throw up, in fact, in that case, you don't need to give any ORS. The child cannot tolerate anything orally. Please visit the next health center or hospital around you. Baby is losing fluid through vomiting and through and running stool. It's a very dangerous sign. Please don't wait. Take the baby to a healthcare practitioner immediately. The baby may need to be given infusion. Having ORS at home or knowing how to prepare ORS we help to an extent. And not only that, ORS is very important for a child with diarrhea. And don't also forget that you need to add zinc sulphate. If your baby is less than 6 months, you give 10 milligrams of zinc sulphate. We have pediatric zinc sulphate. Okay, if the baby is more than 6 months, you give 20 milligrams. Most of the zinc tablet comes in a 20 milligram tablet, 20 milligram strength. So if it is 20 milligram strength, now you are going to break it into two for a baby that is less than 6 months. For a baby above 6 months, to give one tablet. Please make sure you give it for 10 days. And okay, about the ORS should be given within 24 hours. For instance, if you buy a sachet of ORS, you use it for only 24 hours. After 24 hours, you discard. You prepare another solution. And what you are using is 1 liter of water. 1 liter of water. If you have a Pepsi or Coca-Cola bottle that is written 50 cl, what you need to do is to take two clean water. So if the source of your water is okay, fine. But if it is not okay, you can buy a bottled water. Okay, then if what you have in your environment is 1.5 liters, measure out 50 cl. That is a bottle of Coke or a bottle of Pepsi. Measure it out. Then what you have is 1 liter. Empty your ORS salt into the water, shake it very well, and continue to give it to the baby. And not only that, you can also, there are so many other treatments, but most people believe that you should not be given any antibiotics. Well, we are not advocating antibiotics here because people abuse anything they see. So this is not a clinic that go and buy some antibiotics. See, once you start giving the diarrhea, it may be as a sort of reaction to a certain food or element in your area. So if the diarrhea subsides, some diarrhea, most often the acute one, will stop by itself. But you don't want the baby to be very weak. You don't want the baby to lose weight. You don't want the baby to be lethargic. That's the loss of electrolytes. To make the baby weak and become confused because the electrolytes are not getting to the brain, and the baby may not even be able to pass urine because there is dehydration. So that's why it's important to know about diarrhea in children, what to do, how to prevent it. And the most important in the preventive measure, I always say, is that maintain good hygiene. Baby that are breastfeeding, you see, it's the best to use cup and spoon to feed your baby. But people are too much in a hurry. They still use feeding bottles. So if you're using feeding bottle, you must know how to sterilize them, and don't give it to the baby's sibling to go and bring your brother food or sister. At times they put it in their mouth. So it is very important for you to monitor it. Then if you are going out, your baby is a carer or at creche, you can express your milk. Put it in a good place. Let them put it in a water, okay, inside a bowl of water. And when they want to put it inside cup and use the small spoon to feed the baby. But if you are going to use feeding bottle, use the feeding bottle. Make sure it is very, very clean, and you sterilize it from time to time. Sterilize the equipment from time to time. So that's very important in children diarrhea. So